Thank you very much, Amanda, and thank you all very much for joining us. I'm excited for today's conversation, and you'll see why on the next slide when we talk about the agenda. Three folks are going to be guiding you through today. You have myself, we have Chris Rodino, who's one of the leaders in our client success organization, and Dave Sotelo, because when we talk numbers, no one talks better numbers better than an actuary. So Dave's going to talk through some of our clinical impact or some of our financial impact. I said I'm excited because let's be honest, it's December 11th. Our brains are going in a lot of different directions. And so as we were getting ready today, we said, hey, should we throw 75 slides in these 45 minutes or should we keep it a little lighter? And we decided to keep it a little lighter. So we're really going to organize today's conversation just around five questions. One, from a collective health perspective, why we're optimistic about the future. Second, what actually does collective health do? For those of you that are less familiar with collective health, we just want to hit that head on. Number three, how we're using AI to enhance the collective health experience. Number four, why we think that being independent and transparent really matters. And number five, we're going to end with why even CFOs can be excited about collective health. We're going to keep it light, we're going to keep it moving, and we're going to keep it engaging. So we're actually going to start with a question to get a sense of where y'all are coming from. Amanda's going to bring up a poll question. How are y'all feeling about 2026? We won't say the state of the world. We'll focus it on healthcare and health benefits. As we think about the next year, how are you feeling? You have number 10 is you're feeling pretty optimistic, all the way down to number one, or zero, you're feeling pretty pessimistic. Take a couple of minutes.
I love watching it go all over the place.
I know. It started with a lot of optimism. Now pessimism's starting to win.
By the way, that's when you know it's, December right there.
Okay, let's go about 2 more minutes. Or sorry, about 10 more seconds. Okay, Amanda, let's wrap up the poll. So, Chris, we have a couple of nines, a couple of eights, but then a lot in the six, five, four, three, twos. Are you surprised by that?
Not one bit. Not one bit. It's ahead of today when we actually got together live here. It was we were having some passionate conversations, and it kind of made me chuckle because it's December, right? And for all of us that's done this for a minute, it's kind of one of those ones. This is a very uh, I'm not going to say precarious. It's a very heated time of the year. We're trying to get things over the line. We're trying to push through everything that needs to be done. And it takes me back to, hey, is this the year that everything changes? And as I was kind of going through this the last few days, I started laughing because I was sharing some commentary. I've been at this for a little bit of a time, and I was thinking about 1994 and how we were going to change everything, the differences that were going to be made. It was going to be huge. And that was when I was at Prudential Healthcare, which was acquired by Aetna. So it doesn't even exist anymore. But the point with sharing that story is it's a very common theme that we've had. It's like, is this the year that everything changes? In the run up to ACA and everything that has flown out of that, in the waves of transparency kind of getting more and more to the forefront, legislative action, trends in the industry. Is this the year that everything changes? And that's a question that I think, is something that requires a lot of us noodling on. But, for us in particular, I think, with all this, is this the year that everything changes? There's some things to feel really optimistic about. And, for me personally, when I start looking at that, why are we collective health optimistic? Why are we focused on, the possibility of what could be? That's something I think for us as an organization, we take seriously, and it's very much at our core. And when you look at this slide here, this was a really reasonable attempt to kind of start laying that out, right? And when you start looking at each one of these, they're each their own individual animal. And as much as they're oriented horizontally, I would almost say they're vertically as well. Because when you start looking at each one of these, whether you're talking about medical networks, you're talking about carve-outs, you're talking about benefit design, talking about utilization management, advocacy, fraud, waste, and abuse, as much as you look at these horizontally and they ultimately impact cost of care, what you're really talking about is the depth that comes with each one of these. And underneath each one of these, you get to my favorite healthcare answer. It depends. What's the right thing? What's the thing that's going to be most effective for you? And that's where I actually get the most excited when we start talking about, hey, is this the year? When we're talking about this through the lens of collective health, and that's the part that our ability as a TPA, number one, but then number two is providing this optionality back to clients. So again, when you look at each one of these horizontally, these ultimately drive costs, but at the end of the day is how do we start digging deeper, more vertically on each one of those? And the optionality that we provide, whether it's just the fact that we're an independent TPA, whether it's the fact that we have modern infrastructure, it allows us to be uniquely positioned to help drive those vertical conversations, to help drive those vertical options that are ultimately out there. So, hey, the world is our oyster in a lot of ways, but it's also how do we make those choices well? How do we help align, incentives ultimately to drive behavior? And then how do we capture that? That's the kind of stuff when we look at what we're doing at Collective Health, it really, really gets me super excited for not just what is going on now, but it's what the future holds. And kind of a tease on what we're going to be talking about in a few minutes around AI is, exhausting talking about it. Yes, the opportunity grows. The opportunity grows. But with this slide, I think it's just one of those things that really orients us to these are the things we're contemplating. And again, we're not just contemplating them in a very traditional horizontal manner. We're actually contemplating them in a vertical manner as well.
And so, Chris, I agree. I think we're optimistic because it's bigger. The optimism is bigger than collective health. We think there are a lot of great programs and levers and strategies that you can put in place. I think for those of you that feel a little bit pessimistic, maybe one of the places that's coming from is it feels like these are hard to put in order. Maybe you can focus on one a year or two a year, but maybe you'd love to do all seven, but you can't. I think the deep optimism at collective health comes from a place where we say if there was a better way to actually bring these to life, they might be easier to turn on and create more value. And so, for those of you that are less clear about the role that collective health plays in this, we wanted to hit that on the head real fast. Why are we optimistic? Well, it really comes down to the role we play in bringing a lot of this to life. I'm going to start at the bottom. If this is your first time ever hearing about collective health, think of this. First, we are really modern, flexible TPA. TPA maybe not the most exciting thing to be, but it's foundational. We're processing claims. We're administering plans. We're helping to consolidate billing. We're doing a lot of the foundational pieces as a leading independent TPA platform. And the fact that this is all new technology built in the last decade, that means that as AI has become a bigger force, it's been easier for us to weave it into our tech stack. Chris is going to talk about that next, but at our heart, we're a tech-forward TPA. I think of that as backend, meaning we're administering it. But one of the things that makes collective health, I think, stand out is we're not only the backend TPA, we're the front-end advocacy. We are the front-end member experience. We are the digital tools. We are the phone number. We're the people that are answering benefits questions and helping you work through how you're going to manage a complex diagnosis. In the middle there, you'll see Benefits Hub. We can be where your members start for medical, but also for pharmacy, for dental, for vision, for point solutions, for ancillary benefits. Our flexible system means your members can start with one place. A lot of us are either going through open enrollment or just wrapped up open enrollment. We represent the opportunity to say, hey, this year, just start with collective health. Search in collective health, download collective health, call collective health. It all starts right there. And then finally, as you can imagine, if you are the back-end administration and the front-end member experience, that gives you a great opportunity to harness that data. Whether you're one of our clients or one of our consulting partners, give the data back to you so you can really see what's going on. So I promise we keep it foundational. We are the TPA on the back end. We are the member experience and the advocacy on the front end. We are a benefits hub that allows everything to come together. And then that allows connected analytics and insights. And I just want to double click a little bit on the member experience because there's a bit of a duality to us. We are absolutely high tech. That means great apps, great web experiences, available in English and Spanish. Because we're the TPA, that gives us a more foundational relationship with members. So you see 75% of our households have set up a digital account. That's huge. Imagine you're logging in English or Spanish. And all of a sudden, this is where all your medical, pharmacy, dental, vision, EAP, point solution, ancillary benefits, it all just starts right there. personalized to you, personalized to what you're enrolled in. That ease and that connectedness is, I think, one of the things that has helped us keep a 70 net promoter score for the last 10 years. So I mentioned the duality because in one side, we are very high tech and we're great for folks that want to live life on their phone. But we're also deeply personal. We are also deeply high touch as well. I'd say folks often lean on us more for our high touch than even our high tech. We are the phone number that you call. We are the person that calls you when you think you need help. We are the people that can say, let me answer that benefits question for you on medical. Oh, you have a dentist visit coming up? Let me walk you through your dental benefits. Oh, you need more information about the EAP? Sure. Oh, you want me to connect you to your 401k vendor? Absolutely. We are the people that are delivering incredibly high touch support too. You can see on the right, available 6 days a week, 80% of our calls answered in 30 seconds or less. We can support more than 350 different languages. So if you have a lot of tech employees, maybe you like the high tech, but also increasingly, we have a lot of blue collar, a lot of manufacturing, a lot of shop floor, swing shift, lots of languages. Those folks are getting excited about collective health too, because it's one phone number to call. It's one place to start for everything. And so we talk about that duality a little bit, how we are the high tech, but also high touch. That means we have a great opportunity to use AI to make our high tech stuff better, but also kind of make our high touch stuff better as well. Chris, I'm going to pass it over to you. Walk us through how we're thinking about AI.
Absolutely. Thank you, Kirk. And I'm going to actually read this. Rarely do I read on a slide, but this is one that I actually think is very important for me to kind of read through to share. And it's built in the ethos of almost like let's do no harm, right? It's not let's. And then also looking at his AI is not necessarily a gold rush moment, but a moment where we can be thoughtful, a moment where we can test, fail, improve faster. It's a moment where we can continue to put your employee, our member, at the center of the universe. And what does that look like? And when you start thinking about AI in that manner, I think it becomes a bit of a hard road to stay on in a good way, right? Because the nature of how quick everything is accelerating, I think naturally wants to pull you along in that momentum, which can be a very good thing. But again, for us at Collective Health, we're very much looking at this as like, how do we continue to leverage AI, that is, but then also ensure that we're not losing who we are, right? And there's very much, again, it's grounded in the ethos of who we are. So when you read these out loud, it's actually fairly straightforward. AI must enhance the customer experience, never diminish it. And the one that I like here when we talk about this internally is easy on ramp, easy off ramp, right? We're not looking at this in the manner of, hey, how do we continue to push AI in experience in areas of experience? Rather, how do we ensure that there's a way that's easy in and easy out? Because I'm the one that's the worst, right? I call in, and the first thing I start yelling on any time I call in is agent, 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 agent. And I would suggest there's probably some out there that are as equally, let's just say, desiring human interaction sometimes. AI must be as accurate as a human, and ideally a lot more, right? And that's one of those things, again, in the rush to potentially move AI into a platform basis or any kind of consumer experience basis. I think this is where you start to run into how does this work? Are these complementary or are they fighting each other? AI can do no harm to our customers, to our workers, and to society more in general. I think this is a very healthy view. And this is a very healthy view that's kind of built in a little bit of that duality Kirk was mentioning earlier. As a tech company, we recognize we have a very strong responsibility from a technology standpoint, but a technology company operating in the space of healthcare, I think it even amplifies that responsibility more so. And the last one here, AI can never be catastrophically wrong. It must respect the boundaries of human interaction. This, again, I'm going to liken it back to the first one when we're talking about easy on ramp, easy off ramp. There's nothing worse than having a bad experience. And when you start looking at something like NPS, for us, we take that very seriously. And I know that's a little bit unique in the context of the healthcare space. We look at NPS as very much like, how are we doing? Are we doing the right things? How do we improve that? And for us, context is everything. For us, we are very calculated in when we are deploying new technology, but then also when you start looking at these opportunities for advancement like AI. This next slide here that you're going to see, there is a lot happening here in a great way. And the idea, quite honestly, is how do we make this simple? And Kirk mentioned a little bit earlier the idea of, connecting back into front end, right? Like, when we are processing claims, handling eligibility, housing benefits, you have the opportunity of taking all the information that's out there and then creating an interface that puts together an experience that's best in class. That again ties us back to very much our technology-based roots. And when you look at this slide here, you look at everything that's on the left, and these are all the things that we're talking about. These are sticky, right? If we're being really honest, like, some of these things are hard to understand. How do we take the stuff that is hard to understand? Where am I stated in my deductible? What's my cost share for this service? And make it simple, right? And one of the things that I think is super, super important, and it's something that, quite honestly, I would say we're very much on the cutting edge of, is we have a partnership. We work with Google specifically around how we're continuing to evolve our capabilities, number one. But then number two is how are we, evolving our capabilities specific to AI? And our partnership with Google kind of sits in three big buckets. There's a commitment to safety, top to bottom, tying us back to this slide right before this. Ultimately, there's a wraparound experience that we're trying to create. And what I mean by that is, I think it's easy sometimes to get excited about bringing in different options, right? Oh, look, I'm able to do this. I'm able to bring this in here. In this case, when we start talking about a wraparound experience, ultimately the idea is if we're using Google to help push us forward on an AI standpoint, how can we enhance our overall experience with the entirety of the Google capabilities, right? That is something for us when you look at it, whether it's telephony based, there's more to come on that. Whether it's AI based, more on that. Or just from a reporting base, how do we continue to leverage Google in a space where they're advancing very, very quickly to intersect both the healthcare space in general, but then also enhance us as a technology company? And the last one ultimately is, I think, a source of alignment. And it's always a surprise to, I think, hear that when you're talking about a source of alignment between two organizations, one in healthcare and one in technology, that doesn't always fit together in the same sentence. And that is for us, I think, a very, very big difference as an organization. And what I mean by that is, I think at the end of the day, Google will probably partner with anybody that they choose. For us, because we are very much a tech forward type of organization, is how do we work with them? How do we work in synchronicity with them? Are we aligned philosophically around what we're trying to deliver? The telephony piece that I just mentioned is a really good example. We migrated our telephony service just recently to Google's infrastructure. We did that in 90 days. And, I think anybody that's been in the healthcare space for a hot minute, whenever you hear migration, there's no such thing as 90 days. It's usually put another zero behind it. And that seems to be about the right way to look at it. But my point with making mention of that is when you look at kind of the most basic things that impact experience and we're willing to make enhancements to them quickly, this is kind of what creates this alignment between us and our partner in Google. The next piece here that we're going to roll through is really, really powerful. And I'm going to give you a little bit of context before we actually play it. Is, as we're deploying this technology across the board, right? As we're deploying AI, as we're looking at this ultimately through the member experience, how is that going to enhance? How is that going to do no harm? What does that look like in reality? And we're going to share a video here that is just a live example of how the technology is being deployed in the most personal situations, which is at the member level inbound call. And what you're going to see here is just kind of a quick little view of it. And what I would say, there's been a few iterations since then, but this first view is very, very interesting because I shared it with a client. I'm going to play it and then I'm going to share the client feedback right after.
Hi, thank you for calling Collective Health. My name's Kimmy. How can I help you?
Hi, Kimmy. My name's Mackenzie, and I'm just coming from my primary care physician's office, and they recommended that I get some lab work done. What are my benefits for lab work on my plan?
Okay, yeah, let me take a look at what your lab benefits are. Give me 1 second to pull up your plan information.
Okay, great. Thanks.
So it does look like outpatient blood processing and lab services are covered under your plan. If you plan to go to an in-network provider, you will have a 20% coinsurance. This is subject to your deductible, and you have a deductible of $1,650.
Okay, that makes sense. What is a deductible? I don't really know about that.
Okay, yeah. Happy to explain to you what a deductible is. Um, a deductible is a set dollar amount that you will have to pay out of pocket before the plan starts to share healthcare costs with you.
Okay, so I'm essentially going to be paying out of pocket until I hit that amount, and then the plan starts cost sharing. Okay, got it. That makes sense. Okay, yeah,
Yes, exactly. Yep. Any other questions?
that's it. Thank you.
Okay, perfect. Well, thanks for calling, Mackenzie. If you have any other questions, please don't hesitate to give us a call. Otherwise, have a great rest of your day.
Thanks. Bye.
All right, take care.
So this one I'm smiling ear to ear on because I was with a client in real time as we were walking through this. And it was very, very interesting to watch in the room because the client has a AI consultant and talking about how is this working? Is this actually the right information? Where's it being sourced from? How are you sourcing? How are you continuing to train the model? And as like I mentioned before, there are subsequent iterations of this. And quite honestly, it's a tease for the next conversation that we're going to have when we're all together is what does good look like here? And as you see this as kind of, the basic question that's there, the next bit that's going to show up on the slides here is, and it was ultimately a secondary conversation, is being able to take the interface that we have, being predictive, number one, but then number two, being able to say, hey, in plain language, I think this is what you're asking. Oh, by the way, did you know this as well? And when you get to see it in real time, it becomes very, very fascinating because at the client level, this is ultimately sourced from client level information. And this client in particular that I was talking about earlier, that I was actually sitting with, there are very quirky little pieces to their benefit plan, which is fine. And whether that is, hey, you're going to be using XYZ services first from a point solution, the actual virtual agent was able to merge that back in with the MA that was on the phone and provide accurate details. That was the part that I think really kind of shifted the conversation of, wow, this is cool too. Oh my gosh, this is working in a manner that we didn't anticipate. And as I kind of remember, as I'm working through the experience in my head while I was there, is also the on ramp, off ramp of it. That's the piece when you start looking at it. So when you look here again, this is going to be more of our, mobile experience of, hey, I see that you're managing, healthcare for your family. That's a big job. How do I help? Right. And ultimately, again, going back to our ethos on this is, how are we doing no harm? How are we ensuring that we're providing the member with everything that they're paying for and doing it so in a manner where it's, again, plain language, right? Predictive, giving the right information at the right time that's steeped in their benefit plan. And when you look at this, as much as those little boxes, hey, that seems like it's table stakes. I think those are huge, huge deals. I would say in some of my past lives, hey, what is an in-network provider? And then if I go hit provider finder, there's 48 different networks. How do I know which one's the right one? That there are pieces here, and granted, I'm talking about hot state versus cold state, but I think at the end of the day is we're looking at this through the lens of continuing to make it simpler, continuing to make it better, continuing to iterate, not chase. And that's again ties back to who we are. And when you look down here on the right, actually, this is one of those ones that I very much like as well. It's when you look at the optionality that exists at the client level, it's again, how are you bringing those back into the overall experience? Not just saying, hey, here's somebody that's in network, right? You have a point solution that's specific to a condition. This is also available to you. When you see the next screen come up, you're going to see just kind of the continuing iteration of that. The natural language understanding is a big, big deal for us as an organization. And I want to go back to the Spanish experience that Kirk kind of touched on a little bit earlier. Our Spanish experience is spectacular. And in the time that I've been doing this, I am amazed. I am absolutely amazed because it wasn't as simple as saying like, hey, let's go to Google Translate and just take all of our plan docs and go and say, move them to Spanish. It was very much, how do we take and create an experience that's immersed in plain language? What does that mean? Who should help us? Is this the right person? How do we iterate on that? And at the end of the day, you end up with an experience that I would say is best in class from a Spanish perspective. But then secondarily, it gives us a framework to work from as we continue to iterate. Sorry, the language one gets me really excited. So like that's one I love whenever I get a chance to talk about it. And then plan coverage with cost details. Again, these things are sticky benefits. Sometimes they're hard to understand. How should it work? Help me understand that. And this is, again, through our experience overall, digital top to bottom, whether it's mobile or otherwise. Again, it's how do we continue to leverage AI to push that forward in the right context at the right time with an accuracy that's far greater than potentially what would other be experienced. And there's one more to take a look at, I believe there. Yep. This one, it's a simple transition, quite honestly, and it's something, when we talk about what we do here, this actually probably gets me as much as the Spanish language piece. I think this one is a fast follow for me about my enthusiasm about collective health and how we're positioned, number one. But then number two is who we are. And why does independence matter, right? Like an independent is a really interesting word. I think it's getting a little bit overused, similar to like transparency. But, independent is a big, big deal, right? And what does that mean? For us as an organization, means one simple thing, and it's the first thing right there at the top. We serve you, the employer. We don't have competing agendas. We don't have assets, meaning we don't have assets that we own that we are naturally going to funnel people to. That is not who we are. We are very much in the business of being an administrator. We are very much in the business of servicing clients. We are very much in the business of servicing members, your employees. And we're here to do that with a technology foundation that is scalable, it's accurate, it's quick. That's who we are. And that's not something that you can easily say for everybody else that's out there potentially. I kind of chuckled when I was talking about this the other day is, you start talking about, okay, well, independent. We're not bound, like I said, by having any sort of assets that we feel compelled to push people towards, members, employees. But secondarily is, again, the infrastructure component of it's a very interesting one. And I am not a technology person. I'll be the first to tell you that. But I will say is, infrastructure that's been built in this century is probably a little bit better than the ones that have been built in past centuries. And that's a very powerful statement. And that's not me throwing shade at anybody. That is just making commentary that I think is representative of, the ecosystem that we live in sometime. And the next thing I'm going to say on this slide, I know I kind of hopped around here, but if you look directly in the middle, there's one word, right? Flexible. The optionality that I mentioned earlier, we can interchange that with flexible, right? You should be in control. What network makes sense for you? What are the plan designs that make sense for you? What are the point solutions that make the most sense potentially for your population? We're not here to tell you this is better, this is worse. We're here to say, this is your option. We are flexible there. Certainly, we're going to help where we can to point you in the direction if you ask. But at the end of the day, flexibility is what we're about. And the last thing that I'm going to mention on this slide here is transparent. Transparent, again, I think it's one that's been overused in a lot of ways. We're very straightforward in where we're going to make our money, right? We're not sitting here saying, hey, we're going to sneak something in over there. We're going to do something over here. Rather, we're very clear and we're transparent in how we're making money as an organization. And our job is to service you, the client. Nothing more. No optics. We're not going to do that. And I think it's a very, very powerful statement. I think it's a statement that's not something, again, that we say lightly. It's very much who we are.
And Chris, I'll take it from there. You think about that upper right, that our North Star always has been and always will be. You bring things together in service of our members to help them better understand, navigate, and pay for healthcare. And I think it's interesting when you say, how does flexibility help members? How does independence help matters? How does transparency help members? Well, it's because you're able to put together a really best in class experience for them. This is just a snapshot of some of the pieces you can bring together, where it's various Blues networks, or work with provider systems like Providence, United, Cigna. You can mix and match some of those options on the left. Which PBM makes the most sense? Which dental partner makes the most sense? Which vision partner makes the most sense? Because we're independent, our answer is, well, what do you think? What works best for you? How can we combine these? On the back end, let's make sure it all comes together. But on the front end, what if your members had one phone number for all of these things, one search bar for all of these things, one app for all these things, one advocate for all these things? That's where I really think flexibility and independence starts to serve the member too. We think of traditional like medical, pharmacy, dental, and vision. Then I think there's the whole other world that is even more exciting in a lot of ways is, well, maybe the baseline is a medical network, but what do we add on top of that? This is just a selection of the other programs we work with. Maybe family bonding is important. Maybe it's musculoskeletal. Maybe it's primary care. Maybe it's virtual care. Maybe it's complex cancer care. Maybe it's some combination of all of these. Ultimately, it is you, the employer, that gets to decide what is in network. Let's have it be the medical network plus some combination of these things, all bringing it together. So when a member needs care, they don't need to click down and choose which network or think about, okay, well, this is not a part of the medical network. They just know it's part of my networks. It's covered. I can call Collective Health if I have questions. I can search for it in the app. It's all brought together. Now, I promised we'd keep it moving. So we talked about kind of foundationally why we're optimistic. We talked about what we do. We talked about the role AI plays. We talked about the role that being independent kind of gives us that freedom and flexibility. Let's end with something that we're all thinking about right now is, but what about the economics of all of this? Well, one reason why we are optimistic is we think CFOs can be excited about collective health too. And there's two distinct points we're going to make here. I'm going to make the first one, then I'm going to pass it to Dave to talk about the next one. But here's the first one. One of the most interesting stats about collective health, 97% of our revenue comes through transparent PEPM monthly fees. Nothing else. I think we're living in an age right now where people are saying, I have a $5 medical administration fee. Should I be excited by that? Or should I be worried because where are all the other dollars going? Or why are there 37 footnotes? Or sometimes even more terrifying, why are there no footnotes? Where are these dollars hidden? Our perspective at Collective Health is we want to be a transparent administrator. We are going to show you upfront where we make our money. 97% of the time, it is core PEPM fees. Now, there's some whiplash in this sometimes. Sometimes, to steal a phrase, transparency feels expensive because you're like, well, I've never seen such a high PEPM fee before. And our reaction, well, you've actually been paying that. You just haven't realized it. So we think that part of our obligation to our clients is to be incredibly transparent, even in something as simple as making sure we're making money in transparent PEPM fees. No shared savings, no other revenue streams. Very straightforward. So that's on the fee side, but Dave, let me pass it to you now. One of the things we're really passionate about is not only are our fees transparent, we think we're delivering more financial value than ever to our clients. But Dave, no one better to say that than an actuary, so I'll pass it to you.
Thanks, Kirk. And I imagine it's no secret to anybody here that healthcare is facing a lot of pressure on cost trend right now. And when industry experts are forecasting that 8 or 9% medical cost trend is what we all should be expecting in 2026, we're proud to be able to show you here on this slide that over the last 3 years, on average, our book of business has trended materially below that. On PMPM medical costs, our book of business has trended at below 4% on average over the last 3 years. And when you add in pharmacy or prescription drug costs, that turns into 6.5%. However, when I talk about trend for our book of business and when I talk about the impact that we're having on our clients' bottom lines, those things aren't one and the same. That's because there are always going to be unforeseeable, uncontrollable factors that influence and go into our clients' trend results. When we have conversations with our clients about how we're impacting the bottom line, we focus in those conversations on what are the solutions that we're delivering to you or enabling for you, and what are the impact that those solutions are having. And that's a little bit more akin to what you see on the right-hand portion of this slide here. We estimate that across our book of business, on average, we're driving $600 in savings for our customers on a per employee per year basis. And when you take that $600 and you translate it to a percentage of medical and pharmacy claim costs using the typical amounts of per employee spend that are investments that our customers are making on healthcare services, that's equivalent to about a 3.5% savings on claim costs. So I want you to put a pin in that number for a bit, because we're going to come back in a couple slides to revisit that in a little bit more of a tangible way. But backing up a second, when we show these numbers to our customers, one of the first questions we get is, well, what exactly is claims integrity review? What are you doing there, and how are you driving that $35 savings? Or what is care navigation, and how are you driving that $9 PEPM savings? So we want to give you a little bit of a flavor of what specifically are these activities that we're doing, and how do we know that we're driving the savings that we think that they're driving. So claims integrity review, let's start there. This is a sort of a niche area within our clients' larger payment integrity strategies. And it's a niche area that involves some activities and services that not a lot of people are talking about, that not a lot of our competitors are investing in, but for which we think there's a ton of opportunity. And we've been able to become really good at identifying savings for our customers in this area, in things like eligibility audit, duplicate claim review, subrogation, and a few other related categories of claims integrity review services. The reason we've been able to become so good in these areas is, again, thanks to the flexibility of our ultra-modern platform, our ultra-modern technology stack, and our ability to identify these types of claims faster and earlier than our competitors can, and our ability to weave in our own proprietary algorithms and logic for how to identify these claims in the first place. And again, that's all thanks to the fact that our technology is built on this side of the year 2000, and we're able to rapidly iterate and introduce new types of features for identifying and ultimately delivering savings to our clients for these types of areas. And the numbers sort of speak to it here. $35 is our book of business average savings that we're able to deliver for these types of services, for these types of payment integrity review claims, these claims integrity review services that, again, don't get a lot of attention across the industry. And then we also talked on the prior slide about our care navigation program. So our care navigation program is our approach to case management for our clients' most highest need, complex need patients, and as well as the members that will become their most complex need members, so-called rising risk members. It's our way of identifying, outreaching to, and working with those types of members using our multidisciplinary team of clinicians to really address any and all healthcare needs that those individuals have, right? And to ultimately deliver a higher healthcare value, better healthcare outcomes, and lower healthcare costs for that subset of individuals. And how do we know this? Well, we have a matched cohort statistical methodology that we've developed on our own, and that has been independently reviewed and validated by a third party. That third party, the Validation Institute, has published a publicly available paper where they've evaluated and given their stamp of approval to our savings measurement methodology for this program. And that's available for anyone that wants to go retrieve that from their website. But through that methodology, we estimate that we're saving over $8,000 for every individual, for every one of our clients' members that engages in this program. And that's huge. That's a huge amount of savings. So let's go back and revisit this 3.5% average savings overall that all of these programs are driving across of our book of business. I don't know about you, but sometimes a percentage like that can be kind of a hand wavy figure. It's not tangible enough for me. So what we've done is we've translated that 3.5% here to a typical 5,000 employee group that has a typical amount of annual medical and pharmacy plan spending per member. And when we do that, we're able to translate that 3.5% to over $12 million of savings over 3 years. And remember, that is just an average. Some of our clients are seeing a lot more than that in annual savings. Some of our clients are seeing less, and there's some variability from one year to the next. That's just kind of the name of the game with how savings for some of these programs work. But some of our clients are seeing up to 5.5% savings from these exact same programs. And if you do the same math on those numbers, you're looking at nearly $20 million in savings over 3 years. So we really quickly wanted to, hopefully what this slide does is give you a little bit more of a tangible sense of what that 3.5% might mean for a typical plan sponsor in their covered population.
And so, Dave, I think as we combine the transparency, first of all, the independence of our model, the transparency of our fees with the financial value we're delivering, it's another reason why we're ending this year with a lot of optimism. One of the things we'd love to discuss live is, to some extent, talk is cheap. Do you put your money where your mouth is on it? And yes, we have a bunch of very compelling ways that we can back up these sources of savings with various PGs. As we start to wrap up, some key stats for you. We talk about independent. There are not as many independent TPAs as there used to be. We're one of the largest independent TPAs out there. And as the world evolves, we think that's more and more important. We have about 800,000 members nationwide, about 200 different networks and programs integrated into collective health. We've been around for over a decade. We've processed more than $25 billion in medical claims. We're not just a startup anymore. You can see the types of clients who are trusting us in their tech companies, their manufacturing companies. They're white collar, they're blue collar. They're people that live life on their phone, people that just pick up the phone. They're people that only speak English, to other people that have just got to this country and speak one of the 350 languages we support. It doesn't really matter the workforce anymore. We are really good at meeting members no matter where they are. And you can see some of the things on the right: high trust certified, validated, NCQA case management. And so I hope you've enjoyed this conversation. As we wrap up, let me just start or end with an invitation. Every year we get our clients together in Scottsdale for an employer-only thought leadership event. We'd love to make it available to not only our clients, but for any other employers out there that would love to be a part of this really thoughtful event. For our consulting partners that are on this call right now, a question for you to think about. Would any of your clients like to be included in this, to be a part of this conversation? There's a little bit about a collective health, but there's even more about just where the industry is going. You see some information here, and we would love to invite all employers to join us for this event in March. We're running short on time, so if you have any questions, feel free to submit them, and we'll make sure we respond to them after the fact. But let me just end with a thank you. I know time is short in December. Thank you for joining us. We're going to be doing another conversation in early February where we're going to talk even more about our AI strategy. And for those of you that would just love to learn more about collective health, you can see hello@collectivehealth.com. It's a quick way to raise your hand and say, I'd love to learn more. Please take a moment to do that right now. With that, thank you all so much for joining us today. I hope you have a great holiday season. And remember, we're pretty optimistic about the future. We'd love you to be on that journey with us. Thank you all very much.